the law changed. You had to have an actual signature on a piece of paper
for your prescription.
and go and get a piece of paper from your prescriber. And it changed pretty much because of COVID to being electronic prescribing. We need a platform to handle all this information to come through. So that means a digital signature done by a prescriber on their practice management system meant that prescription could digitally go by magic to the pharmacist, and then the patient would get a notification about. And then what I discovered actually was an enormous opportunity.
Meet Stacey Airey, former nurse, now health marketing entrepreneur. She founded Mediactivate from 0 to 6 figures in 2 years, projecting $1 million turnover in the next 1 to 2 years.
We've got the top 10 companies in New Zealand using our services. It's been pretty rapid growth. Mediactivate came around really as a combination of partnership thinking in business, you know, where you look at the services you have, the market you're in, and you think about strategically, you look ahead 3 to 5 years and you ask yourself, what's it going to be like for our clients? What value can we add to our clients going forward?
How did you go,
The aha moment, I think it was probably a combination of...
What was your method or your technique or your trick or your secrets into, because you have to communicate a benefit and a value.
Yes, the total costs of direct and indirect costs of chronic diseases like asthma, arthritis, cancer, diabetes, obesity, stroke. You know, that's to our economy a 30 billion price tag in absenteeism. So anything you can do, I think, within the health system to improve outcomes and improve management and treatment of people in any of those disease states, it's going to help New Zealand.
Quick one, Mina here. Thank you for watching this episode. I appreciate you. Thank you for all your support. One thing that you can do for me is to please hit the subscribe button below. I promise you that if you hit subscribe, I'm going to work hard to make sure that my episodes are really good, that will get better and better. So, do we have a deal? Stacey, welcome to the podcast.
Thank you. Lovely to be here.
It's so good to have you. I am so glad that we get to have a chance to chat, and I've been anticipating quite a significant conversation about health marketing and about your story, your journey, and how you got to be involved from your background to where you are today as a successful businesswoman, as you are an entrepreneur and a bold thinker. So I'm really looking forward for my audience to be tapping into your expertise and knowledge. So I'm going to get stuck into it and talk about, you kind of come across to me a bit like a risk taker. You like to take risks and take bold actions. One of the ones have been about moving from the corporate sector to starting your own business.
Right.
Some people may not know the story. So please feel free to tell us how you made that bold, and maybe like why you made the bold move.
Yeah, I think there was a number of reasons. A lot of it was to do with the period of time I'd been in corporate, I guess, and the balance of my requirements at that time with my family, and the way we worked in corporate was always something that always felt a little bit stifling in some ways.
Yeah.
You know, I didn't realize how creative I was as a thinker or an entrepreneur until I kind of left an environment that was in its way not always encouraging that part of my skill base. Yeah, so I guess it was that coupled with the fact that I had, you know, quite a young family and the idea that I could do something part-time and, you know, figure out another way of earning income other than the, you know, the regular salary and the safety of that salary. So yeah, those two things combined meant that's you know, I made the move.
Did you try to innovate and think differently while you were in the corporate sector and found, oops, can't do that?
Yeah, look, I mean, the sector I was in is highly regulated. So there's an element of you've got to go within rules, and there really isn't any grey area. It's black and white. It's, you know, there's the rule. You stick to it, and that's how it is. I mean, I would try and innovate in things around how we delivered value to our customers.
Yeah.
And I did a couple of things that may have bent the rules a bit. You know, and that's fine. I mean, that was good because you could, you know, always get feedback around whether that is something that is realistic.
Works, yeah.
Yeah.
What's the sector or the industry?
I was in the pharmaceutical industry.
Yeah.
Yep.
So give us a little bit of background about like a quick snapshot of how you started life and how you ended up in the corporate sector, and then fast track to your own work right now.
Right. So I started as a nurse. I did my training from school. I left quite young, actually. Oh, didn't do my final year at school because I qualified to start nursing, which I did in Auckland, and so I did 3 years of training. Pretty much got partway through thinking, almost to the end, thinking I'm not sure this is really what I want to do, but obviously I finished it. What we did in those days was called a staffing year, where you had to spend a year in a hospital doing medical and surgical nursing, which I did. I left that to go overseas traveling, came back from that experience thinking I didn't really want to go back into the shift work. So then I ended up looking at a different pathway that I could use my scientific and communication skills in a business way. And I'd met somebody through my husband who was working in the pharmaceutical industry and talked about what they did. And I thought, well, that seems like quite a good match. So that's what I started up doing. I was repping for a company, driving around the North Shore seeing doctors, West Auckland, in fact, or over New Zealand.
Yeah.
I went and filled in what they called a temp rep. So they had quite high turnover in the industry in those days. So high they had an extra person in the team to go in and fill a region anytime somebody left. So that was my job for a year.
Wow.
Yeah, and then I got a region in Auckland, and that's what I did for a couple of years. Then I moved from that into professional relations, PR, events, marketing, sales management, those sorts of other parts of the business.
Yeah.
And then left that environment, as I sort of said, and branched out into my own business.
And I believe it's called Mediactivate.
Yes, indeed. That is one of the businesses
One of the businesses.
Yes.
So kind of like you've spoken about the chain reaction of how it led you to Mediactivate, but how did you end up starting Mediactivate?
Mediactivate came around really as a combination of partnership thinking in business, where you look at the services you have, the market you're in, and you think about, strategically you look ahead 3 to 5 years and you ask yourself, is what we're doing now, what's it going to be like for our clients? What value can we add to our clients going forward? And so I kind of did a lot of that soul searching with my coach actually over the lockdown years, as I will call them, because things are changing in health, things are changing in business, and it was then I worked through a series of exercises to sort of see actually our current offering in the market, was going to be under different pressure. So I needed to look at other alternatives, which meant that I went out to my network really and I was asking people, well, what are you doing? What's happening for you? How can I add value to what you do? How can you add value to what I do? And that's really where this all started.
That's quite smart to do, isn't it?
Well, it is, and it was quite it was, the coach I worked with really encouraged me to do this because it was we had the opportunity over lockdown to work, in your business. Right, you could work on and think a bit more strategically because we weren't doing all the day-to-day business development because we weren't going to see clients. We just had a whole lot of time become available.
So what were your clients looking for when you were going to see clients? That wasn't Mediactivate at the time.
No, it wasn't that at the time, but it was that client base of the pharmaceutical clients, brand managers, marketing people who are looking really at ways of being smarter and more targeted around what they do with their education and clinical information. So anything that can provide them a gateway or a pathway to make that better is something they're interested in.
So for people who don't know what that means, how can you break it down to understand the business structure before we even get to Mediactivate? Because I would love for you to obviously explain what that is and how it works and stuff like that. So going back into that period of lockdown and the strategy, what was your business model and just to help explain that for us.
Sure. I mean, the business model started off as a kind of a big idea, I guess. The idea, I mean, when it was explained to me, the platforms that were being developed, the software platforms that were being developed, I could just see the opportunity, right? It was just glaringly obvious to me because that was my background, is that coming from that marketing background. And so I sort of had that hat on going, you know, as a marketer, if that's something I was able to access and do, I would be just on it. It was a very exciting idea. So I could see that. So it started really the concept of, as a project-based consulting type concept. You know, I went to the providers of the software. We talked about partnership. They were like, oh yeah, there's a commercial opportunity. That is not why we developed the software, but heck, we see how it could deliver that.
But just to stop you, what would the software do to help people? Just to quickly go over that.
What the software was doing at that time to help people was a big change in how prescribing was being done. So the law changed in 2020, I believe, from you know, you had to have a actual signature on a piece of paper
for your prescription.
And go and get a piece of paper from your prescriber or your medical centre. And it changed pretty much because of COVID to being electronic prescribing. So that means a digital signature done by a prescriber on their practice management system meant that prescription could digitally go by magic to the pharmacist, and then the patient would get the notification about it. Yeah, so all those improvements, you know, all that you know,
making it easier,
just making it so much easier for people, than
less bureaucracy and stuff like that.
Saving time and saving, you know, once you have something electronic, then you can track it. Where is my prescription in the system? Is it ready yet? Has it been dispensed? Can I pick it up?
That's right.
The pharmacist knowing, you know, when things are coming through and having better communication.
I agree.
Yeah. So there was a lot of workflow improvement, if you like, through that whole customer journey.
So how did you fit into all of that change through COVID?
Really fitting in by understanding the power of those platforms, why they were being developed, which is for that electronic prescribing we just talked about. But also they were being developed to assist prescribers to reduce harmful prescribing, and they were delivering these sort of alerts and nudges. The system would automatically find that through the power of understanding all the data in the practice management system. And so clinicians were just, you know, finding that incredibly useful. So I could see that, you know, that not only was the platform in place to make the prescribing easier, it was also assisting the clinician to make a better clinical decision, right?
Bit of an overhaul.
Yeah, indeed.
A new way of doing things.
So I saw that as an opportunity to say, well, you know, if we can, that platform's available to also put educational or other clinical alerts on.
So that's how you thought about, okay.
Yeah, and also at the same time, I was doing this, I launched this New Zealand's first mobile wellness magazine.
Okay.
Called MediWell. At the same time, I was, you know, producing this publication. It was digital. It meant that in waiting rooms, people could use QR codes to pick up health content because, you know, everyone was nuts for QR codes.
Yeah.
Do you remember? We were like, oh, you know, what is this? What is this amazing technology that's been around since 1980? Yeah. Anyway, so because, you know, there were less people going into waiting rooms, so we thought, what else can we do to assist on our MediBoard side of the business? So we developed this digital magazine, and so I was really keen to get that magazine out to as many people as possible, right? Because that was part of
and to educate people. What was in the magazine?
So it was really content around health education,
right?
Reflecting the sort of content we had in MediBoard,
okay,
which is our health content distribution business. Yeah,
gotcha.
So that could have been anything from, like, we had, you know, anything around diabetes, asthma, COVID, vaccination, as well as wellness, mental health, exercise, sleep, you know, all the kind of good lifestyle things in there as well.
Gotcha.
So in my pursuit of launching this magazine, I also understood that this platform that I was hearing about, that group healthcare were developing, could be really good to get MediWell out.
Okay.
So I was really super focused on that. And it was one of those things, when I look back on it now, I realise that wasn't actually the opportunity. And that was, yes, it was a opportunity for MediWell, but in me, actually, I was just really pursuing it with total focus, because that's what I thought would be the way to get this out. I learnt so much about this platform in doing so, thinking the ultimate the ultimate thing here was to get this magazine out. And then what I discovered actually was an enormous opportunity.
Wow.
You know, an enormous marketing activation opportunity. So I kind of went, actually, it's not just about that. It's actually about this other bigger opportunity and a bigger picture.
How did you go,
The aha moment, that's a good question. I think it was probably a combination of reflecting. You know, sometimes when you get so focused on something and you feel like you're hitting your head against a brick wall, and you sort of think, actually, stop hitting your head against the brick wall and let the universe will actually take over. I kind of had one of those moments of, I'm actually pursuing this to the point where, I just need to stand back from it, and what will be. And in doing that, it just appeared.
It's so funny.
It was always there. I just was, I was so focused on one thing, I couldn't see the wood for the trees.
You mentioned a group. What was the name of that group?
Our Group Healthcare. New Zealand. Yeah.
How do they play a role? Because sounds like.
Right. So they developed all the software.
And
so
software for.
This is software for use by clinicians, medical centres, for pharmacy, and ultimately for patients to connect themselves to anytime there's a prescription being generated. Yeah, so they developed these very clever software platforms that connected everything up.
So that the doctor can say, you need amoxicillin, I'm going to write you an e-script, and I'm going to push send and it will go straight to your pharmacy. So that group has developed that technology. They
did, yeah. They were run by Ashley Bloomfield, I believe, 6 or 7 weeks into COVID, to say the project that you've got set up, testing the whole idea, which it had been running for a number of years and was doing very well. Yeah. They knew about it. They knew they could do electronic prescribing, but they hadn't sort of rolled it out, I guess. So yes, they were rung to say...
They were pushed by COVID.
They were pushed by circumstances to go, overnight, we're changing the law for electronic prescribing, and we need a platform to handle all this information to come through.
Because there's been always like that call for making things easier for us, reduce load, reduce paper, and
that's right,
make things a bit cleaner and faster and sweet.
That's right. That's right. So they were the developers of that amazing software, and they're very smart health entrepreneurs.
So you saw an opportunity that you only knew because you stepped backward.
Yeah, exactly. I just sort of had the opportunity to kind of go, what I am pursuing isn't kind of working in that way. Yeah. But in the process of doing that, I just learned so much about this opportunity.
So tell us about the opportunity.
So that opportunity really is that ability to connect on those platforms. Inside the practice management systems that our clinicians, our prescribers use in New Zealand, with good clinical alerts or information that will help them make a more informed or a better decision at that time. I mean, they're under enormous pressure. I'm not sure the last time you went to your doctor, but if you were to print out all the digital records and look at the stack of information they would have to quickly review for your 15-minute consultation, and then understand the implications of all your medical conditions, the medication you might be on, as well as what you're presenting with, do all of that and also meet all the other health targets that they're supposed to be meeting. That's a lot to ask one person, one brain within 15 minutes to do. So these systems are there to assist with bringing the data to them, so it's more easily accessible. And then if there is an opportunity to make an improvement, then a nudge or an alert would come up, which they read and then have the opportunity to either do something about or make it part of the plan for next time.
If someone now thinking, how does that work? Is it like an AI technology or a computer that's reading the entire patient's document and then going summary, and then this is what is useful for this patient? They've had their bloods done. We reckon this medication would be like. How does it work?
Yeah, I mean, pretty much that. It's a system, a very clever cable-like infrastructure that actually connects all the information together. So, and through AI now, like more recently, AI has made a big big impact in being able to collate, information and summarise what is in that patient's record and bring the most pertinent points up. As far as the kind of alerts and nudges are concerned, that's more to do with safer prescribing, preventing any prescribing that shouldn't happen to any drugs that shouldn't be used or prescribed at the same time. So it delivers that alert very with high priority. And it's a bunch of very clever software that that brings it all together really.
So why would you want to do this? Like there must be a reason, a problem that you're trying to solve, and how big is this problem?
Sure. Well, I guess if you look at the cost of ill health in New Zealand, and there's some quite good research and data around this, where they look at the total costs of direct and indirect costs of chronic diseases like asthma, arthritis, cancer, diabetes, obesity, stroke. That's to our economy a 30 billion price tag in absenteeism. So anything you can do, I think, within the health system to improve outcomes and improve management and treatment of people in any of those disease states, and probably a lot more, it's going to help New Zealand. And also, where our health budget gets spent. I mean, Pharmac approve funding of certain products, right? And I think one of the great inequities is that some of those products may not get to the people who they are being funded for. So they don't fund them for everybody, right? Because there's a budgetary restriction, but they can fund them for the very worst or the most severe or the ones that really need it based on clinical guidelines. So if you've got a system that can pick up those records of people who meet that criteria and remind people at the time of prescribing to consider reviewing for this reason, because they may not be well controlled or they're showing symptoms or whatever it might be, then that's, to me, a useful and relevant clinical service.
So the problem is massive, and there's obviously a lot of people who are trying to solve that problem, do something to help solve this burden on the health system and on the economy as well. So where did you take it on from? Like you were like, okay, well, this is an opportunity. How did you turn an idea into a business?
Yeah, I guess I've kind of got a value add kind of mentality. That's the way I look at things. So when I, with my current business and with my current clientele, before I started Mediactivate, I'm pretty familiar with their problems and their issues, right? So I think of what else could I do to help them. That's sort of that's the way I think.
Right.
So as much as I can provide them services in medical centres to get content out there, that's one aspect. But what else could I do? So knowing that there were these platforms and knowing that they were, really well set up now to sort of host other alerts, I sort of pretty much went to them in the good old business development way, which is, you get on the phone and you talk to people and you go in and you meet them and you explain this. And there was a lot of education to be done because, a bit like you've discovered, understanding electronic prescribing and understanding these new systems and these new platforms and the software. What did it mean for them? What did it mean for their, an opportunity that they might assess? So I had to do quite a bit of education around that, and then it really took a couple of companies to take a bit of a risk, I suppose. The good thing is in Australia they've had platforms like this set up for many years, and in New Zealand a lot of their international colleagues had used these sort of clinical services, used this type of activation, marketing platforms in Australia. I guess the difference in Australia is they've got quite fragmented states and a lot of systems being used, whereas in New Zealand we've actually got only one system being used for electronic prescribing. So we're capturing most of the well, we have the ability to reach more people because of that. I took that round, did the face-to-face meetings, did lots of Zoom meetings.
Just for sort of figuring out your way. Asking questions. Like, what were you asking? What were you wanting to find out?
Well, I was wanting to find out how interested they would be in, kind of dispelling the myth. You're a pharmaceutical company. Are you, in the past we weren't able to connect with prescribers and educate them on the use of a medicine when the patient is right there and actually meets the criteria for that medicine, or has a problem, is showing data in the system that they've got a problem with this condition that could be better treated. So as a company, you've never really been able to access that before. So the questions were all around, how well do you understand these platforms? How well do you understand this opportunity? How would you like to be able to connect with prescribers at that time? And then connect with pharmacists and connect ultimately with end users of those medicines so that they get better use out of those medicines. And so it was really a combination of the education side as well as trying to understand, I guess, how they wanted to market and how they wanted to present that information.
Lovely. What did you conclude from all of these sort of consultations?
That there was definitely a need. There was a lot of excitement. I mean, it was it's seen as an innovative digital way to enhance the whole prescribing journey, really. So if you're somebody as a pharmaceutical company, if you're have got a product in that journey, you want to make sure it's being used the best it can be used by the person who it's going to, so they can get the best result from it, right? So you think of like I talked about, the burden of asthma and diabetes and heart disease. Often that can be because of undertreatment or treatment that could be optimized. So if we've got a way to be able to do that by communicating better to clinicians, to prescribers at that time, to pharmacists who play a really big role in education, and as well as to ultimately the end user, you and I, if we're better informed, have more of the information at the time that it makes sense to get that information.
So you almost felt like you had the green lights to go ahead and perhaps pursue something of a potential. Did you have to raise capital? Did you have to do marketing? How did you even start?
Well, I guess the idea really started off as a consulting kind of business. Like I sort of had the ability, I had the partnership with the platform to be able to provide that service.
Okay.
Then I knew all the clients because that's my background and that's my current client base is pharmaceutical companies.
Okay.
So it was really, I guess putting it on a different hat a little bit, sort of creating the Mediactivate offer, what it was, being able to explain it to people.
Yeah, explaining it is...
Yeah, and I guess to industry people, they get it because this is their, this is what they're thinking about day and night. Of course, explaining it to non-industry people is quite tricky.
Yeah. Who are we talking about? Like, who was it tricky to explain things to?
Oh, like people who are not, like, so within a company, if you're explaining it to the medical team, say, or somebody who's maybe not in the marketing team, that could be a bit trickier. Yeah. But I guess we were kind of lucky because the services have been available in Australia, like as I mentioned, so they had knowledge of how this could work and the power of this type of platform in delivering better content for them. So it was, once they understood all the key points of it, then
so what was your method or your technique or your trick or your secrets into, because you had to communicate a benefit and a value.
Yes indeed.
When you reflect back on those days, you were talking about non-industry people. Like who are some of the non-industry people who you really had to like break this idea down to understandable method? Because I'm sure there will be business people listening to this going, I have a business that can be a little bit complicated and there's a lot of turning tables or turning plates rather. Yeah, well I guess this is ultimately, it's a software business, right? Well, the idea is a software platform, and I'm supplying a quite niche service over here, being hosted by this big piece of software. So in explaining that, it really is, I guess the tricks. What were the tricks? I mean, it's just a matter of going over it with people and going over the kind of what has changed and what's going on. And for many of them, they didn't know, or they don't know. Yeah.
So it was really
It's
just
an element of education, right?
Oh, totally. It was an education.
Was it surprising for
exercise.
you that people did not know that this is possible?
Well, it was still pretty new. So, I mean, it started in 2020. We started our first project work in 2022, end of 22. And for some companies, they're like you say, the value and the need and the benefit. For some of them, the need is more obvious and enhanced if their product is only funded for a certain group of people, because they want to make sure that it is maximized in that certain group of people, right? Yeah. So for them, for those sort of problems, they were quite interested in finding out whether how this could work for them.
So what I gather is that you've already had a set of a base clients and people that you've worked with for
Correct.
a certain offering.
Yes.
All you had to do was
switch hats
and then go, I have another value to add to you.
Yes.
And here how it's worked.
Correct.
And what was the uptake rate?
Pretty good, pretty high actually. Yeah. I mean, I think because this is something that is quite innovative and super targeted, and there's a lot of data that comes with it, a lot of market insight and reporting that comes with it that is pretty unique to the system. For that, for all those reasons, all those tick boxes alone, people will, my clients were happy to look at it and go, yeah, this is, let's try this out. And there was a bit of learning around, obviously how we meet the regulations with what we're doing, because obviously we have to follow those rules, and also how best to present some of those alerts to clinicians as well. Yeah. So making sure that's the things are super relevant. We don't just put something up because it's a great marketing idea. That's not the point. The point is it has to be it's got to be a relevant clinical idea to assist that person at that time of making clinical decisions.
So it's not just in a way. I mean, people of course would be thinking, is it a way for pharmaceutical companies to push their own medications and products down to the prescriber? Of course, people might be thinking that. So, yeah, what's the real truth about that?
The real truth is, look, I mean, there's the only way an alert or a nudge would come up is if there was an underdiagnosis, an undertreatment, or a clinical gap. So ultimately, like I sort of said, the burden is on the prescriber to figure all that out in 15 minutes with a lot of information going on. So that the information should be timely and relevant and assist in a better clinical outcome. And that's the only way that sort of information would get signed off. Now, if the clinical outcome is to bring in a different medication because it's more efficacious or it's safer or it's better, then I don't know, I kind of think, well, if you're a diabetic, wouldn't you want the more efficacious, better outcome for your diabetes management? I mean, I personally would. So I would want that option, to be considered by my doctor at that time. So yeah, I think it sort of is that combination of some of these solutions, are medication based, and you want to make sure that they're, we're getting the best outcome for those.
For the people.
For those people, yeah.
Nice. Yeah. So clearly there's an impact being made in clinical rooms and doctor clinics and stuff like that. So walk me through, because actually in terms of timeline, when did you launch this venture?
The service? We started at the end of 2022. So it's been 2 years. Yeah. Pretty much, yeah. And
so
we've got a number of different projects running in those disease areas that we talked about before around asthma, diabetes, heart disease, pediatric or childhood immunisation. And probably from an impact point of view, I think the one that really strikes me is around childhood immunisation, because the system will identify if a child has not been immunised. So any time that infant comes through the system for a prescription for anything, then the prescriber will be alerted to encourage them to review their. It could be pneumococcal disease, it could be meningitis, which are in terms of vaccine preventable diseases and burden on New Zealand if a child doesn't have a full vaccination schedule is huge, right? You want to make sure that kids are protected from that.
Yeah.
And we've seen those vaccination rates
Go up.
rise up. Yeah,
Wow.
definitely. And I mean, there's lots of reasons why maybe an infant isn't vaccinated, so to sort of see that over a period of 6 to 9 months change is really rewarding.
In terms of where this venture, this service is heading, it's 2 years in, it's kind of a new startup. Where do you see yourself in terms of, as the business owner, where do you want to see yourself in 5 years? And in terms of the business itself, where do you see it going?
Yeah, right. Well, I guess in 5 years, I see it as a business that I'm not so involved in a day-to-day basis, so that it's, we've got key people in place around account management and project management and the business analyst side of things.
Nice.
So I'm sort of working towards creating a team that can, grow those services.
Yep.
And there's also other offerings within the platform as well. Like there's quite a lot of there's so much that could be done.
Yeah.
It's actually understanding how to package it into a service that makes sense.
Right.
So that's thinking about, I've probably got about 5 things on a list of, gosh, we can also, we can move the indicator for many, many things when it comes to healthcare with the system. So, what else could we offer our clients?
Expand the offering.
Yeah, exactly. Yeah, expand the offering.
Where do you have any idea at the moment of where you want to, maybe a couple of points, or if you're not sure?
There's a couple of, there's some really good work that's being done around pharmacy and being able to support pharmacy to communicate better to patient groups that they have identified. Again, they may identify a clinical gap or something that's not, that could be improved. So for them to be able to set up ways of communicating via email or messaging to their own client base. So that's the voice of the pharmacy, obviously, because that's where the message is coming from.
Yeah.
So that's something that is quite interesting, and also with vaccination, pharmacy now, of course, in New Zealand doing all the childhood vaccination as well. That's reasonably recent, so they're quite interested in looking at other services they can have to enhance what they do. So that's quite exciting, and. Yeah, so they're probably the key ones, really, just looking at other parts of the journey and what other services we can add.
Fascinating. In terms of the service itself and the number of people you want to reach, obviously 2 years you've have, I don't know how many people that you're working with, how many companies, pharmaceutical companies you're working with at the moment. Where do you want to grow with that?
We've got pretty much we've got the top 10 companies in New Zealand using our services, which is fantastic. So we've been it's been pretty rapid growth with the bigger companies, which is great. And there's probably some more room with maybe some of the middle, the next tier of companies, which is good. And also there's quite a lot of companies in Australia that look after the New Zealand market, and that's a really interesting one because they've got budget to do activity in New Zealand, but they may not necessarily know about the work we're doing because they're based in Australia. So that's my next kind of growth phase, is to look at those companies over there.
Cool. In terms of the revenue, I mean, obviously, did you start with any funding, or you just had your own?
No, I didn't start with any funding. It was really a consulting project management type role, really. It was really me doing the business development and doing the explaining and setting the projects up. Yep. So that was that was really my time. Was the key element in that. Yeah, absolutely. And going forward, obviously, that's something it'll be.
Be a bit less.
More people and different skilled people coming onto the team, and obviously a VA. I could not have done this without a VA.
Yeah,
the right person.
Yep.
So someone on my team who understands all the ins and outs of how the business works, and does a lot of support with reporting. Yeah.
Where do you want it to be in terms of revenue?
Where do I want it to be? I mean, it'll be $1 million company. I would say in the next 12 to 24 months. We sort of quite rapid growth to 6 figures in the first couple of years, so I see that sort of on a trajectory. Yeah.
And that's good. So in terms of the scaling, do you have a plan? Do you have a strategy? What do you when you think about the word scaling, a lot of business owners really struggle with that. They'd love to know also, how do you scale a business like that?
How do you scale a business like that? And it's a great question, Mina. Do I have the answer to that? I guess, look, that is a great question. The scaling will come, I think, in terms of the right team members with the right skills. So it'll be people really for this to scale, and also systems, of course. So people and systems, always systems. So I'm in the process now of getting all those systems, documented and making sure that they can, the 90% of getting everything organised for a client can actually be done, automated or by somebody else other than me, and then really it's sort of the people contact and the continuing understanding the market and finding those projects, right?
It all sounds so exciting, and I perhaps might have another chat with you in a year's time and things might have gone even better and better for you.
Maybe, yes.
You've had moments in your career where things did not go as planned and you had setbacks and mistakes. What has been your biggest mistake in business?
The biggest mistake in business was probably not getting a VA earlier enough. Oh no, I've had other things happen, but no, that was, I had a real mindset block about that, and not understanding really the power of what that could do for my business. So that, I think, really in my more recent history, that's one that I think, oh gosh, if I'd done that 5 years ago, it just would have been productivity and efficiency factor. But probably, other failures I've had were probably more around developing new businesses. But I just learned so much from the failure, I guess. I developed a business called Vetflix, where we took our digital content into veterinary waiting rooms. So we took all the hardware and our knowledge that we had that worked in medical centres and thought, let's take that over to another category, another market. And I tried to launch that into veterinary, and that had some success. And we had some really early adopters from clients and early adopters from veterinary practices. Then COVID hit. And then that was really tough, because those waiting rooms where pets and people wait, just you couldn't even, you weren't even going into them at all. So things went from, a little startup to being, actually, this is not going to go anywhere. So we had to pull out our hardware, our assets from those clinics, and then kind of admit to those practices that we were going to have to take everything down and take it away. And
would you not have wanted to reconsider introducing this again after COVID has ended?
Look, I think it became, that's sort of what I held on to for quite a while, until it became apparent to me there is a point you have to make a decision and go, you're either, what is your vision? And that Vetflix wasn't really part of my vision. It was at the time I did it, it made sense to do it. But actually, ultimately, when I really got into why I'm doing what I'm doing, that really wasn't part of it. Yeah. So it kind of was easier to make the harder decision at that point, once I kind of understood that better. And then I guess other opportunities with Mediactivate and other things make it, my time, I sort of looked at, well, where would I rather spend my time? So that's pretty much the decision I made.
Was it like a big financial loss?
It actually, luckily, wasn't a big financial loss. It was because we could use the hardware in our other business, because it was actually the same hardware, just with different programming. So it wasn't a complete disaster. Yeah. It was just more the time and energy we'd put into it. Because to develop a business from nothing, starting from scratch with nothing, had no client, no idea, no concept, and selling it in. That's a big energy undertaking. Yeah.
So what has been the biggest setback in your business life so far?
I think, thinking back to the time with MediBoard, we had a number of government contracts, and that was to supply one for ACC and some for the Ministry of Health, supplying health content into waiting rooms around New Zealand. And they ran over a couple of years. They were negotiated every year, and with change of government, change of priorities, the spend around things are done, changes over time. And I guess that was a significant part of our revenue and the way our business was done at that time.
Yeah.
So that was quite tricky to navigate because, no one wants to lose revenue. And there's nothing like when you have a government contract because that is, you've got that guaranteed revenue and security. So we just had to, I guess, go sit down and look at, well, as much as you've got those contracts, you don't want to have it breed complacency. So that, so I think there was something to reflect on and go, well, actually, just because you have those contracts doesn't mean you aren't looking for other business, right? So it really meant for our team that we were way more focused on, the other opportunities and finding different sources of income and different clients and different services. It was about that time we launched our digital service. So that kind of meant, actually, although it was bad news at the time, it just meant our direction and our focus actually was better overall for the business.
I'm really sorry about that. I want to change directions now and talk about being a leader. I have a note here. The secrets of a self-determined leader. How hard and hustle drive success. Why being a heart-led leader is the secret sauce for turning a small team into an impactful force. And I think you would testify to that because you've had this opportunity to run teams and grow multiple service-based ventures and have some of them have worked really well and some haven't. Being heart-led, it's important. Why is that?
That's important to me because I think when you come from a corporate environment, it's you can get very caught up in this. It's about the title, it's about the power, and then when you sort of get out on your own and realize that doesn't mean a lot at the end of the day when you're running a smaller team and a smaller business. It's important that you're true to yourself, that you've got that integrity as a leader. So for me, it's important that we're led by compassion. We're heart-led. We're people-focused. People before profits in a way. So our team works really well because we're all there for each other. We're quite values-based. Our values are really clear to every team member. We recruit on values. We work celebrating our values when we see them being demonstrated, and that's an important way to sort of for me that's my style. And that's also meant the team has benefited, I guess, from knowing that they're supported for not only their work priorities but their well-being and their family priorities as well.
So we were saying about how you, to some extent, you are transforming how healthcare is delivered and patients are getting a better deal, right? That's the bottom line, is that they get the right medication at the right time, the right treatment. We were talking about leadership and how important it is to be a heart-led leader, but something is driving that, your why and your strengths. And when you come to your strengths as a businesswoman, what are the what's the fuel that's helping you do this day in and day out? What are your strengths that is helping you do this day in and day out? Well,
I guess there's a few things in that. I guess the strength around understanding what the vision is and being purpose-led, and that's important. I guess an example of that is thinking around, the vision for the original business of MediBoard was to help New Zealanders have better health outcomes through health content, and that's sort of been now extended into Mediactivate. With obviously changing things one prescription at a time, and the services that we do there. So that's important to have that, to be connected to your vision, because that's what drives everything, and being clear about it, and also being open for it to change and open for it to be molded and improved, or some bits added on and some bits taken off. So it's got to be versatile as well.
So being open to changing your vision is important.
Definitely, because things change. We're just in such times of massive change, whether that's AI, whether that's, you know, the way our world is, and, you know, and half the countries of the world being in war with the other half. You know, there's just so much going on in this world that you can't take anything for granted, really. So you've got to I believe one of the strengths I have is I'm pretty good under conditions of change. I'm looking for opportunities, and also with the networking side of things, you know, looking for opportunities for myself or for other people, so that, you know, if as a strength is I'm really connected to my industry and to my clients. So, you know, if I can understand better how to meet, you know, to solve problems for them through the network I have or the solutions I have, then that's something that I work on.
In fact, we might have a resource for these people, don't we?
Sure.
You were talking to me about that before we were filming, about something. So can you tell me about that resource? And I mean, we probably have a link somewhere in the description for that so that people can click on it. If people want to reach out to you and find out more, but want to learn about, this work.
Sure.
Yeah.
Yep. So that's, we've got a great checklist that pharmaceutical companies can have a look at and see if they, how we can assist with a market evaluation, and they may qualify for a free report and some insights into their particular category. And so they can just sort of work through that list and better see how our services could meet some of the issues that they may be having in the market. Yep.
Fantastic. In terms of strengths, so you, as a leader, we're talking about how good you are with vision. What's your other strength that has been able to propel you to double, triple your income or your revenue or grow your, scale your business to what it is today?
Yeah, I think networking is a big part of that. Like I'm a very people focused person. I enjoy people, and I am really quite connected to my industry and my clients, and then it's sort of using, utilizing that network so it benefits them as well as it does me. So it's not just about me and what I'm going to get out of it. It's about, how else we can serve people within that community or within that network. So that's super important to me as well. And I guess a practical example of that is, when I launched the business, I got a group of pharmaceutical marketing leaders together, and we met several times over a course of a couple of months. Some of it informal, some of it formal, so that I could kind of better understand where they're at and what sort of problems they were experiencing, and for them to also understand what we were developing and what we were bringing to the market. So that's sort of a really practical thing we can do. Yeah.
Do you find yourself if like sitting down, having dinner or going for a walk and going, actually, I haven't emailed such and such recently and I should I just do this sort of connection.
Yeah, exactly. And I there's a great thing on Messenger, right? Where you just press the record button and record a quick message to someone.
Yeah.
Like there's such a powerful thing to go, I'm walking along, I'm thinking of such and such. Hey, what about this and this? Or I've read that recently, or I saw this information that would be helpful.
Yeah. Or like sending emails or giving people a call. Do you actually tap into your networks for these things? Do you do that sometimes?
Yes. Yeah, absolutely. Absolutely. Yeah. Like I make an effort to connect with people and I mean, some of it's business development, right? Yeah. To me, that's business development 101.
Yeah.
No, you're in touch with your network on a very regular basis.
Yeah.
And whether that's you're going to get a sale at the end of it, it's not even about that, what I'm thinking. It's more that you're gathering information and gathering insight. You're gathering data, really, aren't you? And whether, you can help somebody personally or help somebody professionally, that's great. Either one's fine, but it's, it is a process of a system of reaching out to people. Yeah.
I'm thinking about your journey and I'm thinking like when you have so many people working with you, you want to be surrounded with the right people.
Mm-hmm.
And you were talking about having a mentor earlier on. Who do you surround yourself with so that you do the right thing as much as possible and move forward, get the business moving forward?
Yeah. I'm pretty deliberate with who I surround myself with. So I have a couple of business networking groups that I'm involved in. One is a Australasian group that we meet 4 times a year, and the business mentor there, Dale Beaumont, who I have absolutely massive respect for, and I certainly wouldn't have this new business even developed or even thought of, I don't think, if I hadn't been exposed to that learning in that community.
I see.
So I certainly put a lot of very connected to that community, and also in New Zealand through a local business networking group that I visit regularly over here at the Crate, and that's just, because I work from home. It's a smallish business. I've got a smallish team, so to be around other like-minded entrepreneurs on a regular basis is just the fuel you need in order to continue on in your week, in your day, in your month, in your year, right? And not just that, but just reviewing that 90-day plan and being accountable to someone other than yourself.
What's a 90-day plan?
So that's a 90-day plan is where you look at your top 5 projects for the next 90 days that will propel your business and your growth forward. And that could be, it could include personal goals in there as well. And it's a really good, nice, simple structure that you can put into place to kind of with yourself and your team members, so that you're all understanding what you're working towards.
Right.
Yeah.
Have you been able to accomplish your goals?
Yes, many times over. In fact, the coolest thing about 90-day plans is to go back and look at ones from, say, a year ago and go, what was I working on a year ago?
Yeah.
And go, oh my God, we achieved all of that. Like, it's that whole gap and gain thing, Entrepreneurs often look at, they're always looking ahead at the thing before, ahead at the next thing, the next goal in order for them to be happy. And there's quite a mind shift change where you go, why don't you look back at what you've achieved and how far you've come? Because that is just gold,
And you do that often, do you?
I do. I go back, because I have it on an app. So I go back it flicks back to the previous, versions. It's quite interesting.
What advice do you think you've gotten over the years that has been one of the best that you've loved? It doesn't have to be one. It could be more than one.
The best advice, I think, coaching and education in the global sense.
But what has one advice? If you think back to someone that you really admire and get inspired by, because by the sound of things, like, you understand the power of being surrounded by the right people who coach you and help you. And you were saying that you wouldn't be here today if it wasn't for that.
Yeah, I think probably the biggest advice, or the biggest thing that I hadn't really tapped into, was around partnerships.
Yeah.
As an opportunity for business and an opportunity to grow your business alongside partners. That's something I hadn't really thought a lot about, and that's pretty much how the opportunity of Mediactivate came around, because I was out seeking that partnership and understanding what was happening in the industry and in the market, and that's how I came across the opportunity. If I hadn't done that work and kind of being persistent about going back to it again and again, then this really wouldn't have happened.
Yeah.
Is
there an advice that you were given once and you didn't?
I didn't take it.
Didn't take it.
Buy the Apple shares? No. Advice that I didn't take. That's a good question.
But then you ended up, taking it on, and it became the best ever received.
Oh, VA. I think that's my VA story. For years.
My VA story.
Well, that's for years people are saying to you, and it's it's a common knowledge that having team members that have got who are skilled, and maybe they're not based in New Zealand, they may be offshore. You can scale really efficiently in your business because the cost is different to our costs in New Zealand and Australia. And I on paper it all made sense, but the actual doing of it and getting the business to a point where I had systems in place and support in place that it made sense to take somebody else on to help, letting go of stuff. You don't have to you don't have to do all the low level annoying admin stuff. Like, it's just
but that's super important.
But your business,
but
it has to happen.
It has to happen, but you don't have
need
time.
to be doing it, and you don't need to. I'm not so much about controlling things. I prefer to just know that things are being done according to a system, and I can have an overview of what's happened. So I think that's probably the biggest one. Yeah.
So, if you were to talk to somebody right now, and they'll say, "Stacey, please tell me 3 things that I've got to know that's going to propel me to the next level, your ultimate business lessons, your holy grail business lessons for you right now," what would they be? 3 of them?
3 of them, right. Well, number 1, make sure you're in a good business network and have a great business coach or access to good business education and support because that just makes all the difference. You can't do this on your own. It is super tough doing it on your own. I did the first, 7, 8 years on my own and to realize actually having support and having that that energy and that content coming to you just makes a world of difference. And the support of like-minded people. That's a biggie. Number 2 would be being open to technology and change. There is just so much changing and available, particularly with AI, around what that can do around the efficiency for our businesses and tools that we can use right now. So being open to having the mindset to learn about it in the first instance and give things a go. And some things will be great and some things may not so, but if you don't know about them and you're not trying things out, then you'll never know. So that's super important. The 3rd one would be really understanding your weaknesses as a leader, as an entrepreneur, and so that you can recruit accordingly. If for me, attention to detail and finance just really isn't my wheelhouse, then I've got an excellent accountant and an amazing finance person. So once you understand that, then you can also learn to get better at things, of course, through education and coaching. But I think it's really good to surround yourself with people that are better at some of these really important skills.
Well, Stacey, thank you so much for coming on the podcast and sharing your wisdom and your story.
You are welcome.
It's been amazing, and I have a huge admiration for you, and I'm very inspired by your path and how you've made it so beautifully. And I'm sure the path may not be as easy. Hopefully it will be easy, but if it's not easy, I'm sure you've got the right structures in place and the right people in place to help you continue to do the amazing work that you do. And and I just wish you all the best.
Thank you.
Thank you.